Is surgical facelift my only option, or there's alternatives in my case? Hi everybody, this is Dr. K. I'm a board certified physician and my specialty is non-surgical lift and contouring using lasers and devices. And in this video, I want to talk about the possibility of options of surgical facelift versus devices, where devices and specifically Endolift as the most effective non-surgical contouring device can be more effective and can give you better results. The first thing that I have to tell you, if you go to your aesthetic specialist and ask them, this is what I want. So you're basically pulling the skin and showing them this is the amount of lift that I need. Usually surgery is a better option. If you are above age 65 with significant laxity, very heavy jowls, and deep lines, either nasolabial folds or even the marionette lines, usually surgical intervention will also give you a better option. The third thing is, if you're looking for dramatic improvement, if you say, I want to look 20 years younger, I want my jawline to be super sharp, and things of that nature, so everyone will notice, usually a surgical option is better for you. However, in the right settings, with the right candidate, right age, right skin laxity, and also the right provider, I can tell you that with non-surgical modalities such as Endolift, my colleagues and myself have been able to create dramatic results, especially if you're in your 30s, 40s, and early 50s. Before I continue, I would like you to check my channel and subscribe and hit the bell if you haven't done, because we have so many educational material that we will put on the page every week that can really help you in different aspects. Number one. And number two, before I continue further, I want you to see a little bit of the Endolift that we do and the results that you can expect.
PCH MedSpa is introducing Endolift laser for the first time in Orange County. Revolutionary laser sculpting from Italy with zero bleeding, zero pain, minimal downtime, and yes, amazing results. Call us today for your complimentary consult. The Endolift laser is the name of the game. Call us at 949-242-9166.
So we talked about age, degree of laxity, looking for dramatic results versus just freshen up and tighter skin. And also, another point that is very important is your skin condition. If you have a skin that has good amount of bounce, that means you pull the skin and it bounces right back, you can get better results with Endolift and non-surgical modalities. But if you pull the skin and the skin cannot bounce back as quick, then definitely surgery is your best option. What I can tell you in general is, if you're looking for refreshed look, tighter skin with better quality, and also some degree of lift and tightening of the jawline, then Endolift can help you if you are the right candidate and if you go to the right provider. This treatment utilizes a fiber optic, and we laser the skin, putting this fiber under your skin, and you can do fine contouring, melting the fat in some desired areas, but really focus on the skin tightening. And it is very operator dependent. So clinic to clinic, doctor to doctor, you can expect a very different variety and spectrum of results. Therefore, you have to do your homework. If you don't want to get surgery and you're looking for non-surgical modalities, definitely you need to do your research and homework and find the right provider with good experience, good hands dexterity, and knowledge of facial anatomy. We have been very blessed in the past 4 years in California and Arizona. We've had the privilege to really have the trust of my patients and perform close to 1,000 of these Endolift cases: face, neck, body, arms, belly, even mons pubis, pubic fat, inner thighs, inner arms, and so forth. And I can tell you the satisfaction rate has been very good, above 70%, and it keeps getting better because we do learn from our patients. There is a very sharp learning curve to this, so definitely experience comes into play. Another important aspect is some of you, including myself, don't want to get surgery. You don't want to risk anesthesia, you don't want to risk cutting, possible nerve damage, and things like that. Of course, there's excellent facial surgeons out there, and I am sure they will do a very safe job for you, and I praise a lot of them. However, this is still a surgical intervention, and you just don't want to get there, and you want to do something to maybe with less results, but still enough results. The good news I have for you is we can combine the lasers internally, which is Endolift, externally, which is fractional light scan, cool laser, CO2 laser in some clinics. And also we can use the power of biostimulation, peptides, hydrating the tissue, the proper skin routines at home. Also, replacing some volume. My favorite is fat graft, that we can get the fat from your belly or body parts and put it basically in your face and neck, and that will give you even more dramatic improvement. Very close to surgical intervention. So we are doing some fat harvesting and create nano fat. We transfer these guys to smaller syringes. Nano fat, you can treat it as a filler. You can put it anywhere in the face or body. It's very, very tiny and delicate, especially for facial contouring. After Endolift is a great option. It has tons of stem cells. We don't spin it, we don't harvest it using laser or energy devices, so it's all very natural and organic and untouched, so the stem cells get preserved. The rest of my radius, patient wanted to do some neck enhancement, so we added some stem cell. He's got some nice enhancement, and this side we're going to work on it. And before I go further, I want to see you some of my results. Also, we will put the link to our before-after album of Endolift results that we have, and I want you to review those. So we covered lots of ground, but to put it all into perspective and just wrap it up, if you're looking for very dramatic results and very sharp jawline, then surgery is probably better. If you're above age 65, surgery probably is better. Although I've had cases such as 75-year-old lady, and we did the Endolift with some volume replacement. Patient was super happy and referred lots of cases to us. So there's, of course, exceptions. But in general, if you want to tell your doctor, I want to look 30 years younger, surgery is probably better for you. But the results of non-surgical modalities, and now there's a spectrum of Endolift, Morpheus, Agnes RF, there's machines like Thermage, of course, there is face tight, body tight, Zerf, and the variety is wide. I've used a lot of them, and I can tell you with confidence that internal lasers or internal endoscopic lift and Endolift is the trait that we use as Italian laser will give you the best enhancements and the best lift and the best results. So you can always combine modalities to get better non-surgical improvements. The skin will improve dramatically. One thing before I finish is if you're doing a surgical facelift, even a deep plane or a mini lift, remember that the skin quality will still be the same. So you still need your lasers. A lot of surgeons I know use a CO2 laser, which is a good modality with 1 to 2 weeks of downtime. But what do we do as non-surgical laser lift? We combine Endolift with some other cool laser and superficial transdermal lasers to really rejuvenate the skin and get you the best skin quality that you truly deserve. And then adding boosters such as exosomes, growth factors, peptides, salmon DNA and things of that nature can improve your healing, also can improve your collagen bioreformation. Hope that helps you. Definitely, if you are somebody who is considering a non-surgical modality or have done something, either surgery or non-surgical, comment below. I want to know your experience. I want to know what you went through and how happy you were from 1 to 10. That will really help us to provide even better service to other people. Definitely make sure you subscribe, and I will see you in another video very soon. Dr. K, adios. Thank you for watching.